Ivy.
Hi, Dr. Katie.
So you were referred to me by your primary care doctor for numbness and tingling sensations?
Yeah, I've been having a lot of numbness. It's very random. Sometimes I get like numbness on my legs. Sometimes I get it kind of like going down from my back towards my leg. I've gotten some tingling sensations on my hands as well.
Okay.
Sometimes it feels like my head is going numb a little bit. I'm not really sure what's going on.
All right, that could be a variety of neurological issues that we're going to assess today. Is there a time of day that this is more frequently happening?
I think I do notice it more like in the morning after I drink coffee.
Okay.
So I don't know if that might have something to do with it.
Interesting. Okay.
The other thing is when I'm like really stressed or like at work, I'm dealing with something stressful, and I start getting all these weird feelings.
Okay, that's really good to know. What about when you're touching certain objects? Are you able to feel things, or do you sometimes not feel at all?
I think it's usually okay with my hands. I get more like tingling, not so much numbness, but I don't know, I haven't noticed that.
Sure. Any joint pain?
No.
Okay. So we're going to do some neurological tests to make sure that your symptoms aren't going to be caused by any nerve damage. Okay? Can you verify your first and last name?
Yes, first name is Ivy.
Okay.
Last name ASMR.
Great. Okay. And your date of birth?
My date of birth is June 22nd,
Okay.
1992.
Okay. And at its very worst, on a scale of 1 to 10, how would you rate the numbness?
I'd say maybe like a 5 or 6.
Okay. And has it gotten progressively worse?
No, but it hasn't gotten better either.
Just gotcha.
It gets sometimes worse during the day, sometimes better.
Yeah.
It's just like there.
Okay. Did you start drinking coffee more recently, or have you just always?
No, I've always had
Okay.
a cup of coffee. I don't drink a lot, just one cup.
Yeah, that should be normal. All right, and have you started any new medications in the last few months?
No.
Any change in diet?
No, not really.
All right, what about any new topical treatments like lotion or soap that you're trying new? Can you think of anything?
No, not really.
Okay, yeah. Okay, so we're going to start by testing your coordination, okay?
Okay.
Okay. So I want to start with your hands. So if you could place your palms, the back of your palms, on your knees.
Okay.
Okay. And then I want you to flip them over and back as fast as you can. Just do a series of those. Great. Okay. So go ahead and do the same thing, the starting position. Okay, so what I want you to do is take one hand, touch the other hand, place it back, and don't move the other hand to touch the opposite until this one is back on your knee.
Okay, so.
Yes. Very good. Okay, all right. Okay, go ahead and stop. So next I want you to, can you touch your finger to your thumb? Okay, can you touch each finger to your thumb? All right, and do that as quickly as possible, and do it if you can in order from index finger to pinky. Okay. Okay, the other hand. Okay. Great, all right. So next I'm going to go ahead and test the strength of your fingers.
Okay.
So I want you to slide your thumb here in this big one and fill the other fingers in the rest of the holes.
Okay.
Okay. Very good. All right, I want you to stretch your fingers out as wide as you can. Good. Okay, I'm going to go ahead and measure. So 83.7 millimeters. Okay, go ahead and rest. All right, and do it again. As wide as you can go. All right, 123.1. Did you feel any pain when you did that?
No, not pain. It's
Okay.
just
All right.
hard.
It's a little difficult.
Yeah.
Okay, go ahead and switch to the other hand.
Okay.
All right, go ahead and stretch as much as you can. All right, that one's a little less in strength. It's only 72.7. Okay, do it again. All right, 120.5. So it seems like the left hand is slightly more weak, but are you right-handed?
Yeah.
Okay. Thank you. All right, I want you to close your eyes.
Okay.
Okay. And just hold out your hands, rest them on your knees again. Good. I'm going to give you a couple objects, and I want you to hold them in your hand, and I want you to describe the object for me, the shape, the texture, and anything else that may come to mind.
Okay.
All right, so this is your first one.
It's like an egg-shaped
Very good.
object. It's like soft and squishy.
Okay. And what's the size of it?
I don't know. If it's right on the palm of my hand, say maybe 3 inches.
Okay. That's a good enough assessment. Here's your second one. Go ahead and feel that.
And it's like a ring.
Mhm.
It's a little bit flexible, but still hard.
Great.
It's like rubber
Okay.
or something.
And so the texture, would you say that it's hard or soft or somewhere in between?
It's somewhere in between. It's like a hard rubber, but it's still rubber.
All right, great. And you're able to hold it all in one hand?
Mm-hmm.
Great. Okay. Here's the next one. Go ahead and feel that with both hands.
So I think it's a key.
Great. Okay, what's the texture?
It's hard,
Okay.
but smooth, like metal.
All right, good. And the size?
Just like a regular key, maybe
Key size key.
2.5 inches, something like that.
Very good. If you give me both of your hands, keep your eyes closed.
They're like coins.
Very good. What's the texture?
They're metal. They're engraved or something. They have some texture to it.
Very good. Hard or
Also letters.
soft?
It's hard.
Okay. And what's the size?
I would guess maybe like a quarter.
Excellent. Okay. Very good. All right. I want you to keep your eyes closed. Actually, open them. Sorry. I want you to touch your finger to your nose.
Okay.
All right. And now touch my finger. Do it again. Okay. Keep going. You can slow down. Okay. All right, now close your eyes. I want you to do the same thing. I'm not going to move my finger this time. I'm not going to torture you that way. But try to do it as fast as you can. Very good. Okay. Thank you very much. Was that difficult?
No.
Okay, good. All right. I'm going to go ahead and do a cranial nerve exam on you. Okay, just to test the nerves in your face. So I'm going to start by just palpating your skin and head, okay?
Okay.
So you can just relax, close your eyes. I'm just feeling for any signs of swelling or inflammation. Okay, I'm not feeling any swelling. I'm going to go ahead and check your limbs as well. Okay, go ahead and open your mouth for me and close it. Okay, no signs of TMJ. Alright, do the same thing here. I'm just testing your jaw strength. Okay, I'm going to palpate just the top of the head. Okay, just going to be feeling along the neck for any swelling there, along the trachea. Any pain here?
No.
Okay, pain here?
No.
And let me know if you feel any pain. Just feeling along the lymph nodes for swelling. Okay, the back of the neck. Okay. No signs of edema that I can tell. Alright, so you can go ahead and open your eyes. Try to look up at the ceiling, okay? I'm not going to let you do that. Try to turn your whole neck up. Very good. Excellent. Okay. So do the opposite. I'm going to go ahead and try to look down at your chest. I'm not going to let you do that. Very, very good. Alright, so I'm going to test just the range of motion on your neck.
Okay.
So on the count of 3, try to turn your whole head that way.
Okay.
Not your body, just your head. Okay. 1, 2, 3. Okay, good. And 1, 2, 3. Excellent. Was that difficult at all?
No.
Okay, good. Now I want you to make a big puffy face for me. Just widen all your features. Very good. Okay. And next I want you to try to lower your eyebrows. Okay? Good. Alright. I want you to raise them in 3, 2, 1. Alright, good. Keep them raised. Try to lower them in 3, 2, 1. Alright, excellent. Any trouble doing that?
No.
Okay, great. Okay. Alright. So I'm going to test your smell and taste next.
Okay.
So close your eyes. I want you to let me know what this smells like.
Orange.
this one, what does it smell like?
I'm not really sure I can smell anything.
You can't smell anything?
Mm-mm.
Okay, try again.
Okay. I can smell it, but I'm not really sure what that is. It smells like, I don't know, like sage.
Okay. Right. All right, I'm going to give you something to taste. So if you could open your mouth.
Orange.
Okay. And next.
Like lemon, maybe?
Okay. Maybe just looking inside your eye now. So if you could look straight ahead. Okay, your pupils look round and reactive to light. I'm not seeing any enlarged veins. Okay, I'm just going to look right underneath the lid here for any signs of redness or scarring, which I don't see. Looks very healthy. Keep looking ahead. All right. Very good. Okay. Now, I want you to follow this light for me. Okay, so follow the light. Keep your head straight. Very good. Ignore my fingers. Very good. Okay. Now I want you to tell me when the light enters your field of vision, okay?
Okay. No.
Okay.
No. No.
Okay.
No.
Great. Okay, and if you could let me know when my fingers enter your field of vision.
Okay. No.
Okay.
No. No. No.
Okay.
No. No.
Okay. Good. Okay. All right. Go ahead and look ahead for me. Okay. Your tympanic membrane is pearl gray. I'm seeing a bit of wax buildup, but it is wet and not hardened, which means that it's not impacting you. So that's good. Looks very clean and healthy. Nicely gray tympanic membrane. Okay, I'm going to switch. I'll look inside. Okay, very healthy. Good. Right. So this is a tuning fork. I'll be bringing this closer to your ear. If you could close your eyes, I'm going to be making a sound, and I want you to let me know when the sound stops, okay?
No.
Good.
No. No.
Okay.
No.
Good.
No.
Okay.
No. No.
Okay.
No. Oh, I'm sorry. That one didn't stop.
No.
Mm-mm. Can we try that one?
Let's try that one more time.
No.
Very good. All right. So keep your eyes closed. I'm going to be making two different sounds, two rustling sounds in your ear. I want you to tell me in which ear you hear the sound, okay?
Okay.
Right, left, or both?
Left.
Good.
Right. 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 Left. Both.
Okay.
Left. Both.
Okay, great. All right, Ivy, I'm going to ask ask you to go ahead and put on a gown so I can have just more access to the body and skin to test your sensations, okay?
Okay.
Great.
Sounds good.
Great. So Ivy, I'm going to do a sharp and dull test, okay? So close your eyes. Do you feel this sensation?
Yeah.
Okay, so that's going to be a dull sensation.
Okay.
This is going to be sharp, okay?
Okay.
So let me know which one you feel. I'm going to be doing it all throughout your upper body, so including the face, arms, and hands.
Okay.
Okay,
Dull.
good.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. No, that was sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Sharp. Dull.
Okay, let's put your hands on your knees and flip them over for me. Excellent.
Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. I didn't feel anything.
Okay.
Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull.
Okay. Do you feel this?
Yes.
Does it feel cold to you?
Yeah.
Okay. That's going to be a cold sensation, and then this will be warm.
Okay.
So tell me cold or warm, same thing as before.
Okay. Cold. 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 Warm. 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 Cold. 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 Warm. Warm. Cold. Cold. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. 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 Cold.
Go ahead and flip your arms over, or your hands, yeah. Okay.
Warm. Warm. Cold. Warm. Cold. Cold. Warm. Warm. Cold. Cold.
Okay. So I'm going to be placing a pressure on your skin Do you feel this as a single pressure point?
Mm-hmm.
Okay. And this is a double pressure point?
Can I say that again?
Yeah. So this is 1,
Okay.
and this would be 2.
Okay.
Okay, so I might be putting them both on one side or splitting the difference, but either way, let me know 1 or 2 if you feel 1 pressure or 2. Okay? Good.
1, 2, 2, 1, 1, 2, 2, 2, 2, 1, 1, 1, 1, 2, 2, 2, 1, 1, 2, 2, 2, 1, 1, 1, 2, 2, 2, 1, 1.
Okay, will you flip your hands over for me so your palms are facing upward? Thank you. Continuing.
1, 1, 1, 2, 2, 2, 1, 1, 1, 2, 2.
All right. So, continuing on, next, I'm going to be scraping your skin gently with this tongue depressor.
Okay.
I want you to tell me if you feel it on your left or your right side. So just say left or right, or if it's in the center, say center.
Okay.
Okay.
Right. Left. Left. Right. 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 Left.
Okay. Put your hands up like this. Very good.
Right. Right. Left. 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 Right. Right. Left. Right. Right. Middle. 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 Left. 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 Left.
Okay. Go ahead and flip your hands over. Just a few on this side.
Right. Left. Left. Right.
Okay. So, one of these cotton swabs is wet, the other is dry. So say wet or dry, depending on which texture you feel, okay?
Okay. Wet. Dry. Wet. Dry. Wet. 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 Dry. Wet. 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 Dry. 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 Wet. 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 Dry. Dry. Wet.
Okay, flip your hands over. Good.
Dry. wet, dry, dry, wet, wet, dry, dry.
Okay. We're going to do one more before switching to your lower body, okay?
Okay.
So far you're doing good. Some discrepancies, but we'll discuss that later.
Okay.
Next, I'm going to test your sensation to vibration. So you're going to feel a vibration. And these will be in different joints of the body.
Okay.
And just like we did in the ear exam, when I stopped the tuning fork and you stop feeling the vibration, say now.
No.
Good.
No.
Good.
No.
Okay.
No. 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 No.
Okay. So you can flip your hands over. Good.
No. 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 No.
All right. Next, I'm going to have you lay down so I can check your feet and your legs.
Okay.
Okay. All right, Ivy. Go ahead and relax. If you could uncross your legs for me. Thank you. Continuing with the sharp and dull, let me know which sensation you feel. This is going to be dull, and this will be sharp.
Okay.
Did you feel the difference?
Yeah.
Okay, good.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay. Good. We'll be doing cold and warm again.
Okay.
Okay, so this is going to feel cold, and this will feel warm. Do you feel
Okay.
the difference?
Yes.
All right.
Cold. Warm. Cold. Cold. Warm. 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 Cold. 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 cold, 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 cold,
Okay.
cold, cold, dull, no, warm, 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 warm,
Okay.
cold, cold, warm,
Good. Okay. I'm going to be putting these globes on your body, and I want you to tell me if you feel them on the right or the left, okay?
okay, left, right, 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 both,
Good.
left, 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 right, 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 left, both, 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 right, left, right, left,
Okay. Okay. So just like before, this is going to be a wet sensation and this will be dry. So
okay.
just tell me which one you feel.
Dry, dry, wet, wet, dry, dry, wet, 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 dry, wet, wet, dry, 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 wet, wet, dry, dry.
All right. And we're almost done with this portion. I want you to do the 1 or 2 tests with me again. So this is going to be 1 and this is 2 points. Do you feel the difference?
Yeah.
All right, let's begin.
1, 1, 1, 2, 1, 1, 2, 2, 2, 1, 2, 2, 1, 1, 1, 2, 2, 2, 2, 2, 1, 1.
All right. Mostly accurate. I'm going to have you flip over so I can examine your back as well, okay?
Okay.
Alright, so I'm just going to unbutton the first 3 back here, okay? If at any point you feel uncomfortable, let me know. Okay, this is just to expose the back. Alright, excellent. So we're going to do sharp and dull sensations, alright? This will be dull, this will be sharp.
Okay.
So just let me know which one you feel.
Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Okay. We'll be doing cold and warm again. Okay?
Okay.
This is going to feel cold. This will feel warm.
Okay. Cold. Warm. Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. 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 Warm.
Okay. Okay. Beginning the pressure points again. So this is 1,
Okay.
this is 2.
Okay.
All right.
1. 1. 1. 1. 2. 2. 2. 1. 1. 2. 1. 1. 2. 1. 1. 2. 1. 2. 1. 1. 1. 1. 1. 2. 1. 1. 2.
Okay. Right. Right. We're going to do left or right, okay? Just let me know if you feel the sensation on the left side of your body or right, okay?
Okay. Left. Left. Right. Right. Go. Left. Right. 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 Both. 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 Right.
Okay. Again, with left or right, but this is a different texture. This one will be brief.
Right. Left. Right. Left. Both. Left. Right. Both.
And one more test with the tuning fork. Let me know when the vibration stops.
Okay. No.
Good.
No. 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 No.
Good. All right. I'm going to have you sit up and we're going to go over the results and the next steps to take, okay?
Okay.
Right. All right, Ivy, I saw quite a few mishaps, especially in the 1 or 2 test, okay? Which indicates to me that you might have some neurological issues. Most of the tests you did well, so it could be nothing, but I want to be thorough and I'm going to order a CT scan and MRI, all right?
Okay.
And then I'd like to schedule an appointment to see you again after you have those tests complete so we can go ahead and look for a treatment plan, okay?
Okay.
All right.
Sounds good.
Thank you so much.
Thank you.
All right, bye.